Can you tell us a little bit about Ethos and how you're helping agencies kind of close that readiness gap?
Sure thing. So at Ethos, we are not a defense contractor. We are a commercial tech provider that's venture-backed. So we try to move at speed. What we provide is an AI-enabled human readiness platform. I'll explain more what we mean by that, but we essentially take the current outdated training materials, bring that into our platform, format it for digital natives, and allow them to learn the way they are used to learning. So we are trying to do that at speed and trying to do that affordably as well.
And Michael, over to you to round us out. Bingley has a fascinating story around AI and the patient or citizen experience in healthcare space. If you can tell us a little bit more.
Yeah. Thank you, Hillary, and thanks for having me join the panel. It's exciting. My family doesn't think AI in healthcare is exciting, but I do, and I'm sure you do as well. So I've been in healthcare for 30 years. I'm one of the senior leaders at Bingley. And Bingley, I know I'm going to use a little jargon here, but we fall under a broad category of care orchestration, AI-enabled care orchestration, which just means we're leveraging AI to streamline a lot of the workflows that are critical to physicians and nurses making decisions. And just, we're citizens, but we're all patients in this room. So if you think about the patient story, that drives about 80% of all clinical decisions. So we leverage AI to automate that in an intelligent way so that physicians and nurses can operate at the top of their license instead of being glorified transcriptionists. So I'm going to get into some of the other stats, but there is a significant labor shortage, and what we're doing is addressing that labor shortage head on so that care can be delivered at a more predictable, higher quality way with a great deal more efficiency.
Excellent. I want to start by first looking at the broader issue here and diagnosing that modern mission challenge and talk about what are some of the demands today and where is AI making the biggest impact. Mike, I'll start with you. You know, you talked about Maximus working across the full life cycle of government modernization. What are agencies really asking for when they say they want to be mission ready? And what do you think has changed their expectations recently?
Yeah, I always come back to the fact that governments worldwide are really faced with the requirement to do more with less. That's foundationally what the challenge is. Budget pressures are continuous, and citizen expectations for the delivery of government services are increasing. And so this provides a really ripe opportunity and a mandate really to figure out how you go do that. And I think we've been instrumental in doing that for a number of our customers. So that's one, right? Doing more with less. The second one is the technology landscape is evolving incredibly quickly. And part of the reason why our partners are up here with us in Bingley and Ethos is making sure that we can help connect not only citizens with better government services, but also the government with better innovative technologies that are coming out of Silicon Valley and the like, right? And two excellent partners here, very different technologies, but both AI in nature and helping to deliver against that mission. And that's where I think we provide a really good mechanism as a company to make sure that we're using both Maximus technology as well as our partners to be outcomes and mission first. So we identify what is it the outcome that the citizen, the government is trying to deliver. We have over 50% of our contracts are performance or outcome based already. And so we're key enablers to make sure that companies, partners like Ethos and Bingley that may not have the breadth and depth of experience in government procurements and contracts and the like can partner with us to make sure that we're delivering on behalf of the citizen. And making sure that the government has access to the best technology out there, ultimately better serving the community and helping to do more with less.
And focusing on operating in the citizen and healthcare space, Michael, I'm going to come back to you. You've touched on it a bit in your opening and introduction to Bingley and about your company and the offerings, but what gaps or frustrations are you solving right now with AI, and how does that support that broader public trust?
Yeah, this is going to be a little depressing. So by 2028, we're going to be short 100,000 critical clinical workers. 47 out of 50 states by 2037 are going to be short in primary care, OBGYN, and pediatrics. So there is this significant shortage of people that are supposed to take a significantly growing demand. So we're looking at those areas to really make our existing clinicians more efficient. But just as important as efficiency is clinical quality. So there's a lot of talk about LLMs and hallucinations. So we don't want to use LLMs to guide clinical decision support. We want deterministic modeling. Some examples are Schmidt-Thompson, which for everybody, that's nurse triage. It's the gold standard. So for nurse advice lines, we can use technology to automate that process and make it 3 times faster by leveraging that digital intake process. So we're really leveraging technology in those critical kind of junctures of patient care, et cetera. And unfortunately, without that, you'll see that 80% of all serious medical issues occur because of a lack of good care coordination. Why does that happen? Burnout doubles the risk of adverse events. So if we're not taking care of our clinicians, our nurses, our doctors, patients are going to continue to experience worsened care. So we're leveraging Bingley to automate digital intake, for example, but we do so with clinical protocols that are evidence-based, deterministic, and drive value and quality just as much as they do efficiencies.
Thank you. And Jay, finally, your work with Ethos sits at the intersection of human capital and technology. What trends are you seeing around employee readiness and overall digital transformation?
Sure thing. So the big one we're seeing is, tens of billions, hundreds of billions of investment is going into systems. So on top of that, the content in those systems now has a lot more software and AI. So what does that mean? The update cycles have gone exponentially faster. So that's good. What we're not seeing, though, is a commensurate investment in the training so that warfighters or the users can stay up to speed and use the systems effectively. We have systems that are fielded today without any warfighters sufficiently trained to operate them. Just think about that. So this human tech divide is what we're focused on and trying to solve.
Excellent. And so this is kind of where that, I'll call it the total experience lens comes very powerful, connecting the people, processes, technologies to really push these ecosystems together and push that transformation that's going to stick. So I want to unpack a little bit more about how these are all coming together, and that focuses around how Agile innovation powers, we'll call it total service delivery, right? Bringing AI, the best of the best tools together to deliver impact, not just automation for automation's sake. So I want to talk a little bit, Mike, how do you integrate partners a little bit more, if you can share, how you were integrating Bingley Ethos into that larger, secure, AI-enabled tech stack, if you will, one that is agile, scalable, that doesn't completely disrupt mission process?
Yeah, so we've released, I think it's been about a year and a half ago, we released what's called Total Experience Management, TXM. It's our reusable platform for delivery of government services digitally. And that ecosystem has a lot of common functionality that applies to a number of different use cases. It's all secured in a FedRAMP moderate boundary or the equivalent, which improves or accelerates the ability to get an ATO or accreditation in systems. Because I go back to the fact that so many of our programs touch so many Americans and other citizens, we see a lot of design patterns across that ecosystem, so that we can identify common challenges across government use cases, always tailored in. And so what we've done in that environment is, how do we identify where technology is a big enabler, even though implemented a little bit differently across different agencies? And these are two companies that really exemplify that, right? I mean, if you think about what Ethos does in terms of using AI to help the readiness and training of people coming into systems, that's a prolific problem across a wealth of the estate in the government. So that's an instant force multiplier for any system processing tools that you're delivering on behalf of the government. But we wanted to help them get through the barriers of, well, but how do we bring that technology in? So helping them with FedRAMP certification, access to markets, access to contract vehicles, and the like. That 1 and 1 equals 3 together, because at the end of the day, the government's getting better service because of what we've enabled in our experience in the market. On Bingley, similar pattern, very different use case, right? As you'd mentioned, there are many programs across the government with different types of triage and care coordination type challenges. And the proven technology from Bingley truly stands out in the market, but it's hard. It's a challenge for a venture-backed, a small company to come into this market and really have the impact that it should. So we've worked with them again to help lower the security barrier, help them get over the security barriers that exist, get them into the market, and help deliver the impact. And so, that's what we think our kind of responsible large contractor base really is as a company is, how do we have better accountability for delivering outcomes? And if we have better accountability for delivering outcomes to the government, I'm going to invest more of my dollars to make sure that I'm bringing the best, the brightest technology through our partners into that ecosystem, because I'm both financially incentivized to do it, but also kind of morally and ethically as part of the company we are. And that's what creates a really good market dynamic to make sure that the best technology is winning the day, is getting into the systems, and at the end of and delivering the best outcomes for our customers.
And Jay, I'm going to come to you next. You touched a little bit about it before, about the defense space and the training programs that you develop there. How do you at Ethos keep up with the pace of innovation when it comes to those readiness training programs?
Great question. So we use AI in a couple novel ways. So what we normally walk into is a situation where the schoolhouse or an operational training facility has very outdated materials. They're not out of date, they're outdated, okay? So step one for us is we use AI to ingest all that material into our platform. So we're here at a Gen AI conference. For this step, we don't want to generate anything. We want to replicate. So we want to bring the data over one for one. Very difficult to do. Step two, though, we do want to generate. And this is where we use AI to reformat the materials for what I said earlier, the digital natives, for the folks that grew up with a phone in their hand. Along the way, we're also using advanced learning science, active learning, metacognition, so that it's a much more engaging way for the students to learn. And the net effect of that is they learn faster and they retain it longer. So that knowledge decay goes very, very far down. Also along the way, though, we're capturing data. So what we call this is datafication, but what it enables is data-driven interventions for individual students or for an instructor. Maybe you've got an entire class struggling because of a poor instructor, or we can also use it to identify curriculum gaps. So we do all of that at speed because we are SaaS and AI enabled and working with tech partners like Maximus.
Yeah, and even outside of the DoD environment, there's that same design pattern happens again and again, right? Think about, anytime you have a customer service representative that's coming on board to help, answer phone or talk with a citizen around open enrollment for a short period of time. Well, you got to be able to train those people, get them into the system, make sure they're productive, retrain, recertify, all that, and that's a very similar design pattern, just a very different use case, and why we're so positive about the partnership and what you guys deliver, because it's critical to accelerate things that are already being done, but make them faster and more accurate.
So going from an internal looking with training and readiness to a more outward patient, citizen-facing, Michael, this is coming to you. As you look to integrate different AI solutions within Bingley into that broader digital front door, which is digital front door is very prevalent. It's a lot of conversations these days in the federal space. How do you work to create and put in those new AI solutions without creating silos or frictions within existing agencies or customer workflows?
Yeah, this is going to sound naive, but I'm less concerned about integration today because we're seeing how AI is even helping with that. So for example, in like the veterans DBQ, their disability process, they have to get a CD and then they have to look through that CD to look at all of their different symptoms, diagnoses, and then somehow convert that into the DBQ process, all manual. They do have a VSO that helps them out, but it's very manual. We can now use AI to go through that clinical record. It could be a photo or a PDF, and we can glean all of their clinical history and bring that in. So I'm not as concerned now about the technical integration. We do API, iFramework, et cetera. What I am concerned about is process improvement not being a part of that process of integration. So there's a funny story we use in healthcare. It's, multi-generational families sitting around a dinner table, and the daughter goes, "Mom, why do you cut the ham at both ends of the ham?" Goes to the grandmother, the great-grandmother. The great-great-grandmother finally says, "My oven was too small." So we inherit these processes throughout the continuum of care, and what we need to do is leverage AI, but we cannot simply automate broken processes. We have to automate and improve. So really being deliberate about looking at workflows, partnering with our clients, and making sure that we have an intimate understanding of what their end goals are in that process.
And that's where I think, Maximus, as I mentioned earlier, we have over half of our contracts are outcome-based. That's what we truly mean by outcome-based is, the outcome isn't refreshing technology. It's delivering whatever that mission is supposed to deliver on. And I think when contracts are written, acquired, and incentivized that way, you get better solutions. And that's what, we try and stand in front of the crowd and say, because it's true that we have a better accountability model, right? The government doesn't get their service, the person doesn't get enrolled, the veteran doesn't get their disability, whatever that mission is. If that doesn't happen, that's on us. We want to take accountability for that. And when you're truly driven by those outcomes, then the differentiation of the tech isn't random acts of AI. It's a measurable impact on the end outcome of the mission that happens to be AI as the implementation mechanism to do there. But through that lens, it's a lot easier to call balls and strikes as to whether or not we're doing random acts of AI and random acts of technology, or we're doing it with intent and purpose that drives the end mission.
Yeah, and just to comment on the Maximus partnership, without Maximus, we would not have the breadth, the people, to do that critical analysis of existing processes, and more importantly, to understand the broader ecosystem. We would fail without that partnership because you just bring such depth of understanding of the customers, you help us navigate, and more importantly, you bring experts we just can't, as a small company, afford to bring on. So it's a great match.
Thanks. It's been, and hopefully at the end of the day, the whole intent of this is it's a better outcome for the government.
Yeah.
It's a better outcome for the citizen. That's the ultimate arbiter.
Absolutely. I want to change focus here a little bit and talk about deployment to measurable mission impact, and hear from you all about some real world results, because I think that's helpful when you can apply contextually. You can share different case studies or success stories a little bit about how your work is really focused on that mission alignment and service delivery. Michael, you've seen measurable gains in how citizens are triaged, routed. Can you share a success story or a little bit more about what that looked like maybe on the ground?
Yeah, we've done side-by-side comparisons with a traditional triage where a nurse really is managing that entire process. And we have seen productivity gains 3x. People don't believe you at first, so we say at least 50%, but when you go through it and you reduce the burden of the administrative intake off of that nurse, it is a 3x productivity gain. And more importantly, we've seen a great resignation of the really experienced nurses beginning in COVID. So with structured protocols like Schmidt-Thompson, we can actually standardize care, so your outcomes are also improving. And then finally, we know that patients are eager for a digital experience, especially when the average time it takes a primary care doctor visit to get scheduled is now 30 days. So if you can get them engaged with the digital experience, they're happier, they feel like their voice is being heard, and we're capturing a better voice. So we've seen 80% conversions from manual to digital intake.
That's amazing. And I want to ask Jay, how are you helping to help customers go beyond the check the box training, right? And actually prove readiness, performance improvements in actual workflows and environments?
Sure thing. So whenever I hear check the box, it takes me back to my Navy days. I flew fighters for the Navy as a first career a long time ago. But all of the training was input based. It literally was check the box, get the X. Have you done these flights, these simulator sessions? Zero linkage to proficiency, okay? It is a very outdated way to do training and education that unfortunately is still in use everywhere. So what Ethos does is we come from the other direction. We come from the outcome side. We want to make sure that we are measuring proficiency. What does that knowledge graph need to look like to get a warfighter to where they need to be, okay? So that's how we focus. A quick ROI story, if you will. We do work across a lot of the different services within formerly DoD, now DOW. I'm still having a hard time getting used to saying that. But one good example is we do work with the Air Force Weather Forecaster Squadron, okay? Relatively small schoolhouse, but very dense, complicated material. So before we became involved, they had a horrific washback rate. So they would have students get a third of the way through, half of the way through, fail, and then they would start them over. And this would happen multiple times because they've got to get the output into the Air Force. So they brought us on, instituted our platform, and we were able to enable, number one, a flipped classroom model. But the net effect of that was we were able to reduce their washback rate by over 50%. I mean, so dramatic gains out of the gate. The budget savings, their ROI that they calculated, so remember, small schoolhouse, was multiple millions a year. So we're driving a lot of budget savings. We can accelerate students through courses, all kinds of different things that we can provide. But that's a great example.
Yeah, thank you. And Mike, finally to you, when success comes together, you mentioned a little bit ago about total experience management. Is there one proof point, case study, success story that you can share about how that kind of ecosystem of TXM has created change?
There's a number of them. I'll just kind of hit the wave tops on a couple. In some of our clinical assessment business, one of the examples that we use there, you talk about the mountain of paper and other based documents that come into an evaluation for a number of different programs that we run. There's a mountain of paperwork, right? And it's when a clinician has to read, digest, summarize that information. They either miss stuff, it takes forever, right? Or it's just a bad experience for the individual coming in. We built a series of AI systems there where we process about 10 million pages of records a day. So think about the amount of savings for that clinician that doesn't want to spend their time reading, right? They want to spend their time diagnosing, and that's out of the equation. Similar thing we had on other programs where we had pretty significant massive increases in caseloads that have come into government services programs to the point at which traditional processes and people were not in enough volume to handle, right? What may have started off with, hey, we're going to handle this with people because it's not an overly large problem, but all of a sudden, because of changes in the environment, think COVID or otherwise, all of a sudden that caseload is massive. It is a very, very different problem that no one forecasted. We've changed a number of those systems over to significant AI integration where we've taken backlogs of cases that are many months in length and knock them down to zero to make sure that we're not getting the people out of the equation, but we're making sure that the people are more in quality assurance, QC, overseeing. They're not spending their time reading cases, summarizing cases, and being librarians effectively, right? Yeah. They're using their brain for what it's intended, which is the deep understanding of the individual situation to make an informed decision. So you're being both efficient and effective in those cases, but also you're giving a better outcome to the citizen. We could keep going on and on with some of the things we did during COVID, but I think that's the general trend that all of us see is, you start with what the mission outcome you're trying to deliver, understand the context and the process and the people and the tools that are being applied to that, and then figure out where are the touch points where AI or other technologies can make things better, faster, cheaper, and that's how you do it.
Excellent. And finally, I want to look ahead a little bit. What's next for Mission Ready AI, and where do we go from here? So this one's a group question, so whoever wants to buzz in first, feel free. But the question for you all is, what's one big shift that you expect in AI and intelligent public service delivery? So if you had an 8-ball right now, shook it up, what's one big shift that you anticipate down the road?
I'm happy to go. I think there's one of the big shifts we see is most of the application of AI that we've talked about today is really about making more efficient and effective outcomes, right? So really taking the administration of government programs or the application of technologies to a warfighter and making those processes more efficient and effective, really kind of doing the same or equal with less, and in a lot of cases more with less. I think where we really see this sector going is, well, but how do you gain insights and actions into the things that might happen next, right? And so, we've have pretty significant investments in advanced modeling and simulation to take what might be the situation today and start to fast forward and start to gain insights as to what might happen next. So how do I better prepare my government systems for increase in caseloads or changes in conditions, or how do I prepare for a next health event or a world event happening that's fundamentally changes the nature of it, so that I'm not just delivering the same thing better, I'm actually fundamentally looking at what policy decisions can I make, and can we help the governments understand the impacts of on the delivery of government services? Because I think our politicians are always in a very challenging job, which is making policy decisions that affect citizens and the outcome of the nation, but they very rarely have, I think, quantitative environments where they can truly almost fast forward the world and say, what if I did this or that and the other? What do we think might happen in the future? And that allows us to build more resilient systems based on not just the here and now, but what those potential futures might be. I think that's where we're most enthusiastic about kind of getting in front of the challenge, not just always responding to the most recent.
Yeah, kind of similar in my domain in healthcare. The biggest adoption of AI is like AI scribes, and what I'll call is passive AI solutions. They're automating some rote tasks, but the biggest shift and over 50% of the hospitals in the US have done that and are happy. There are others that have done it, not yet happy, but they'll get there. I think the real big shift is where Bingley is right now. You're going to see us move from passive AI solutions to integrated, evidence-based clinical support decisions that are specifically being used to triage patients to async, virtual, et cetera, but just evidence-based deterministic platforms that are actually going to start making decisions, always with human in the loop, but making decisions rather than just summarizing data or structuring large data sets. We're going to see a quick transformation into evidence-based guidance in healthcare.
The other one that I would mention, just kind of on the acquisition side of it, is we're already seeing the motion towards outcome-based contracts, faster routes to contract, and I think that's been a motion for a while now. I think this administration, rightfully so, is accelerating into that. I think as industry, I welcome that, particularly in the outcome-based contract world. We need to see more and better public-private partnerships where we're held to account for what we're contracted to deliver on behalf of the government. I think that's a trend that's accelerated recently, and I hope it continues to accelerate. And I don't see any sign of slowing it down. But that also you go back to why these partnerships work is, then it does take partnerships to deliver holistic outcomes, and no one company is going to have the tech to do all of those, all the solutions for the government. When we operate a lot of systems, we have deep system integration, delivery, and operational knowledge. Companies like these, like Ethos and Bingley, are really revolutionary in their sectors, but how do you combine them together for outcomes? And I think that's the foreseeable future for government contracting.
So I'm going to divert a little bit, and the trend I want to talk about is one that I hope to see, because what I'm seeing right now is folks in the government, they completely get that they need AI, but they don't understand what's required to actually provide it at scale. And if you go out, and I was at the Army event, AUSA, last week, I was at the Air Force Association event 3 weeks back, I was at DSEI in London 6 weeks back. AI is everywhere. What folks are not talking about, though, is most of those discussions are only about the use of AI at unclassified commercial levels. So in order for us to use AI at FedRAMP moderate, at FedRAMP high, in the DOW world, the impact levels 2, 4, 6, there's a whole other list of certifications you got to go get. And for us, working with partners like Maximus makes a huge difference, because we're able to not just get hosting at that level, but we can now use AI and customer-facing tools because they've helped on the certification side. Okay, but if you go ask most of the government customers, they're oblivious to the fact that in addition to hosting, you also have to get the AI certified for higher levels of security.
Yeah, I think you also kind of adjacent to that brought up something that I think is a lot more common across the industry and government than sometimes we talk about, and that is we've been talking about AI's impact on the mission, and that's the forefront of what we need to go do. But all of us are running organizations or leadership in organizations of different type, be it government or industry. And the nature of the workforce and the workforce needs are going to change along those lines too. And I've talked with government customers about the fact that, okay, it's going to change the landscape. The skills and the nature of work going forward in all times are going to change. It's our responsibility as employers, as mentors, to make sure that, I know at Maximus, I want to make sure that if I'm changing the nature of a job for an individual, that I'm helping to upskill them into the next role. No different than if you're a government employee doing that with another government employee or otherwise, right? And I think the more we can communicate as an industry that how we're handling continuous upskilling of our workforce within this will, that's a critical conversation we need to continue to have. And I think sometimes there's a perception that there's a divide between industry and government in that, and I think that's erroneous. I think we're all, as managers, as leaders, going through that same thing, right? And the more we talk about it and get it out in the open and have common solutions, I think the better off we'll be. Otherwise, we're going to have a backlash on the mission due to other factors.
Fantastic. Are there any questions that you all have for our panelists today? I'd like to open it up if there's any questions for them.
Gotta be at least one, or else you can't leave.
We'll go in the back. Well, you raised your hand in the back. So. That's okay.
Regarding technical implementations, with what you've done with automation, and to some degree it looks like maybe beginning with agents so far, what has been the most challenging technical hurdle you've had in your implementation?
I'll start on my side. It is very rarely a technical hurdle. If you metaphorically, the implementations that we've done, the technology part of it is this. All the other aspects of it are about like that. And what I mean by that is access to data, the security accreditation of whatever technology you're using, the contractual language that says I'm able to use that data, policy on. Even and I include this even on internal, like Maximus's internal use of AI in our systems, right? It is all of the other aspects, I think sometimes are way more challenging in terms of the timelines of implementation than the actual technology itself. And sometimes it's because people don't recognize that you have to do all these other things before you can use the tech within it. Within that tech layer, often it is the data that you have, and whether or not it's well curated to the purpose, and that the outcome that you're trying to generate is understood, right? I would say those are the aspects of the technology itself, but it's that larger landscape, to me, that is the biggest hurdle in any AI implementation that I've been a part of.
You had a question as well?
Hi, Mike Strobel, Pace University, and Armament Engineering School at Picatinny Arsenal. So, I had 100 questions because all three of you touch everything. But I really had this question that started to come up because of the work that we do, and we touch things, and it's not just U.S. government, but internationally. And Mario Draghi wrote a wonderful report trying to explain what the EU is apparently at least a decade behind. Have they reached out, and are they interested in what we're doing, and with regard to some of their solutions as well?
I will say, broadly, yes. I mean, I look at this as I've been in previous roles where I was actually foci mitigated into the U.S., right? So I've been kind of on all sides of the international coin, and how we're starting to how you share technology internationally. And if you think about particularly AUKUS, Five Eyes, right, our key partner nations, all of these governments are trying to solve very similar challenges. They have sometimes different attributes, constraints, or otherwise given various differences in countries. But the things that you're talking about up here are relatively prolific across, particularly kind of Five Eyes, Europe, NATO countries, and I think that's why we're trying to make sure that there's partnerships that can help span boundaries. And every time I've talked either with our, say, Canadian or UK governments that we serve, or partners of ours that happen to reside in those countries that we're trying to proliferate across, it's very similar challenges across the board. And I think that's where initiatives like AUKUS or NATO or otherwise are hopefully helping to lower those barriers, so that with respect to ITAR and other legalities, we've got to be very clear about that. But there's a lot of opportunity across those environments to solve problems that are communal to all of them. And so I think there have been a lot of conversations, but again, I think the biggest hurdles have been in policy, legislation, and sometimes on the sharing end of it, more than whether or not the technology works. And the last thing I'll say on it is, I often think that looking at some of our Five Eyes, NATO and other partners, they're solving similar challenges, but sometimes they do it in slightly different ways, right, including us in the U.S. And I think we can learn a lot from those different implementations and the successes or not about what's working to help inform policies that should be more universal than maybe they are.
Go for it.
We actually currently do have installations in the EU and UK, but they're not part of the military apparatus. It's with the state of NIH in UK. And what's interesting is we complain about the length of time it takes to get things done here. They look at us and go, gosh, wouldn't it be nice to be over there? So I think that the level of adoption, we do tend to lead the way in the United States. And through Maximus, for us in particular, that is the way that we are expanding into those other areas outside of those kind of private clinical environments.
And just real quick, sorry, Jay. I mean, if you go back to the fundamental premise here, which is how do you use innovative, up-and-coming technology and companies to impact the mission, I think you have to look no further than the basic stats in the DoD, DoW space of look at the proliferation of venture capital and venture-backed companies across the world. Look at NATO's Diana, NATO Innovation Fund, and the sovereign desires of technology in other countries, right? That means there's a whole lot more chips being put on the table to innovate for Five Eyes nations. I think we as an international community that supports democracy, right? The more we can help share that technology and the lessons learned across it, the better off we're going to be as a global community, while at the same time obviously protecting our interests at home from a sovereign point of view. Sorry, Jay.
Yeah, so completely agree. I mentioned I was at the DSEI conference about 6-7 weeks back. We were doing that because we wanted to dip a toe in the water to see what the international demand signal actually was, and we were thrilled, and we were already in partner discussions across all of the Five Eyes and NATO. So to your point, yes, they recognize they need it. What Mike said about policy, they're not just lagging in tech, they're lagging in policy generation. And right now it's kind of the wild, wild west in some of those countries. So there's work that we can help with. Okay.
Any other questions?
Michael, this one's a little bit more tailored for you, but we're getting ready to go on a journey. I represent a company of first responders, ground and air, and trying to take kind of our APCRs to that AI model to help with the transcription, right?
Yeah.
And kind of along the line of making sure we're getting that medical necessity document for billing claims,
Yep.
and to give them more time to spend with the patients, right, in the room. So I was just curious if you could share some of the challenges that you faced in that journey and kind of how you overcome. There's a million different angles of challenges.
Yeah.
But just hoping you could expand a little bit more.
Yeah, and I think it's what this Mike said. I think broadly, change management is the big wall. So I've learned to find champions that are not necessarily the gung-ho AI champions, kind of middle of the road. And be methodical in building trust and relationships during that evaluation process, getting them comfortable, because if you can get a champion with someone that's kind of middle of the road, versus everybody knows that one AI guy that, or person that does this. But so building relationships is essential from our side to your side, and then really being thoughtful about change management. And then human nature is, it's easier not to make a decision than to make a decision, because that's so much more risky. So the whole evaluation and due diligence has to be about building that human relationship, that confidence, that trust, and then pilots. And I think this kind of ties into the risk sharing environment we're in. We're very open to pilots, because for years people have been promised a set of goods. And there's a bunch of shiny, good ideas on shelves everywhere, right? So stepping in and building that trust through pilots is one way that we do that. But again, we really rely heavily on our relationship with Maximus to also be able to identify those pilots that are going to be most successful. But does that help?
No, it does. And did you face any challenges on the governance, security, compliance side of the house of getting the approval to move forward, especially with some of the new state law regulations that are coming out that we don't know what we don't know yet?
Yeah, we see the pendulum being, we're going to just try everything, and then, no, you don't want to put sensitive documents in ChatGPT, right? And then the correction, which is don't do anything. So one of the recommendations I do make is really look at your AI evaluation processes. And on the healthcare side, we have the Hippocratic Oath, do no harm. I think we have to really continue the education of what LLM is good at and where deterministic models are critical. Ambient AI is great, but where do you use it? When do you use it? So I think the organization on your side has to come together and create that filter. What will we be okay with? What degree of risk are we okay with? What degree of risk are we not okay with? And what are the important things that we're going to be looking for in each of our areas of kind of targeted AI segments, but having that policy up front so that it keeps into check the people that are just going to want to do everything really quickly, and then also those people that are very reticent. I think having that policy, that ethos, is a huge first step.
Yeah, and kind of along those lines, I mean, the better you can document what are those outcomes that you're trying to get to tends to be a rallying cry that the spectrum of individuals that are involved in the process can at least agree to, okay, yeah, we all agree that this is what we're trying to do, right? And that here are the major elements of people, processes, and technologies that are brought together to go deliver that outcome. What might we want to go do as a community next to help drive that outcome and have measurable results, right? Whether it's a pilot or otherwise, we're going to go try X, right? Here's the policy, blah, blah, blah. And did it measure a realistic outcome? Also, I think there are also a lot of emerging technologies that can help ease some of those policy decisions. We have another partner. There's been a pretty significant proliferation in things like confidential computing. So confidential computing is basically, think of it as the ability to, if you want to go run AI on some data, you can do that without attribution to the data, but get the outcome out of it, right? So if you had multiple different organizations, say, that wanted to come together, whether they be international, different organizations, different classifications, but you wanted to be able to do some algorithmic work on top of it, you can have technology not have to break down all those policy barriers, but have attributable data in those individual silos that can still come together and drive an outcome. So there's some technology overcoming elements there that could ease some of the policy decisions as well, if that helps.
Any other questions?
Yes, on that list comment, something that I've worked, cybersecurity work, data classification. I'm envisioning, having worked with some of this in DoD, and you have to have a whole separate process set up for data classification, don't you?
I'll talk about it. One of the things that we like to do inside Maximus is anything that we put into the mission, into a customer's hands, we do first internally, right, where that's practical. And through that lens, I'll tell you how we're doing this is data is never going to be perfect. Be that at the classification marking level, the quality of it or otherwise, some attributes of that data are more critical and more important than others. I think classification would probably be at or near the top of that list. But I think the way we try and tackle those challenges is how do you still drive outcomes while your data process is moving forward, right? Because if you say, hey, I'm going to wait till my data's perfect to start my journey of process and internal improvement, you're going to be waiting a long time to have any proliferation forward. We try and do those things in parallel to say, like, well, what is the state of the data today? What is the state of the policy? And what things can we do to impact the mission now while we are on that data journey, right? And those two tracks have to run together. The better that data journey gets, the more you can enable AI on the top of it. But we've also found that it's very illuminating when you start to apply innovation to your existing data ecosystem. Might give you some insights into your. I think I got the hint. It may give you insights into your data ecosystem that you didn't understand beforehand. And what I mean by that is, so we've got like internal knowledge management systems that allow us to kind of aggregate data across a number of different internal systems. And it's very illustrative to us to say what data I thought was important to the enterprise isn't always bearing out to be as important as I thought it was, right? And other pieces of data that I discounted were actually more important than they were, which can help guide your data journey to say, well, hey, where do we want to make sure that data classification, tagging, or otherwise is is focused effort. I think that's a kind of an ongoing exercise that we do, at least internally, to guide that equation.
Okay, thank you.
Fantastic. I'm just going to take a minute to wrap up our panel today because we're approaching time this afternoon. Thank you to our panelists and for you coming to our session today. We've talked a lot about different diverse portfolios, solutions, offerings, which is what made me excited to host this panel for you all. But I think within the right ecosystem partnership, we've talked a lot about how we can move faster, deliver smarter, more trusted, and create more impactful experiences for government and customers and citizens. So with that, thank you.
Thank you.
Thank you.